everyone. Let me just make sure. I am just so thrilled to be here today. Always such a fun time having candid conversations with you all. For those who don't know me, I'm Dr. Funke.afolabibrown, and I am the founder of Restful Sleep MD and the Restful Sleep Place. And we're going to have a very interesting conversation today. I think it's going to be really enlightening because there are things about mental health and psychological testing in children that I don't know. And I was just telling Dr. Stacey, I'm like, I don't know. So I think this will be very beneficial. Of course, we're going to work sleep in one way or the other. But I just wanted to start that. You can tell we're the cool girls because we were both just talking about the fact that, woohoo, we're in with our, there we go, with our Stanleys. And, it's like, okay, you know what, I think we hit it off right. And I'd gotten a thumbs up from my daughter when I got my Owala. Sorry, the Stanley is out, right?
So Stanleys are out.
I'm telling you. And then the other thing is that we had this incredible networking event, almost a month ago right now already, where we had phenomenal clinicians from all over. We had psychiatrists, psychologists, pediatricians, ENT specialists, all different people from different walks of life, dentists, all of that come together in this amazing networking event. And Dr. Stacey was there, and she was the amazing winner of Beyond Tired. And so the book is making its way to you, I promise. And
I'm so excited.
I can't wait for you to read it. But let's start with some introduction. Tell us a little bit about yourself and what you do and all of that good stuff.
Sure. So hi, everyone. My name is Dr. Stacey Gagliano. I am a psychologist at the Center for Neuropsychology and Counseling, which is located in Chalfont, Pennsylvania. And so I do a lot of things here at the center. I do both therapy and assessment. On the therapy side, I do individual, family, and sometimes couples therapy. I really specialize in children, teens, young adults, but I do see the lifespan. So I have patients of all ages that I work with. And then on the assessment side of things, I do psychological evaluations. So that looks at, we'll talk, I know we're going to talk a little bit more about what psychological evaluations, what that means and what that entails, but I do those for all kinds of reasons. So again, that's all ages up until what we would consider older adult population. That's where kind of my expertise stops. So young children, teenagers, young adults, and typical adults, where I evaluate, diagnose, and give treatment recommendations. So, and I'm also a nationally certified school psychologist and I still do some consulting work with schools. I do independent educational evaluations for school districts and things like that. So I wear a lot of hats here.
I think that is phenomenal. And I think it just goes to show the breadth and the depth of your expertise, because, we were just saying just before we hopped on, and you were saying about how busy it is, right? And when you think about that as as someone who, works in a practice that's growing, of course, we want growth. But then that at the end of that means there's a lot of need. There's a lot of need when it comes to mental health in children and so many more issues going on. So thank you for what you do, because I feel like
Thank you.
Oh my goodness, it's such a need. But maybe tell us a little bit more around what are the kind of conditions you typically see, and then we can move, sort of backtrack and say, what does that look like working through your programs?
Sure. So, in mental health, we have what are considered levels of care. The mental health system is incredibly confusing. We all know that, right? Unfortunately. And, we have different levels of care depending on what your needs are. And so I work in what's considered outpatient, meaning that, what we think of as typical therapy, where someone comes for therapy once a week or maybe every other week. It depends on what they need. as your needs intensify, you might seek out a higher level of care, like an IOP where you go to therapy 4 times a week, or a partial hospitalization program where it's all day, and it goes higher from there, right? But so the Center for Neuropsychology and Counseling is an outpatient. We're an outpatient providers, and so we meet with our clients anywhere from, typically once a week to every other week, or sometimes once a month, depending on what the patient needs.
Mm-hmm.
And then on an assessment standpoint, we're conducting outside evaluations. So someone wants to get clarity on their diagnosis and treatment recommendations, they come to us, and we meet with them a series of times and conduct this evaluation. So on the diagnosis level, on the psychological evaluation level, we see people for all kinds of reasons. So anything you can think of, pretty much, that is associated with mental health. And that includes autism spectrum disorder, other developmental disabilities, neurological conditions. Sometimes we end up seeing brain injury, learning disabilities, and then, all kinds of social and emotional and behavioral diagnoses, ADHD, anxiety, depression, bipolar disorder, personality disorders, all kinds of things like that on the assessment side. Treatment-wise, in terms of intervention, in terms of therapy, I typically, again, have a really wide range of diagnoses that I work with, or presenting problems. Not everybody comes in with a diagnosis, obviously. And again, that in a lot of my patients, that includes ADHD, anxiety, developmental disorders, social difficulties, behavior and emotional dysregulation, depression. It kind of runs the gamut. So I hope that answers the question. But
absolutely, no, it does, because, like you said, there's so many layers to this. And I think, sometimes there's even like school counselors, and then from there you're going to, it seems like it just kind of works its way up. But in terms of just how that looks logistically for families, say they have a child who is struggling with, anywhere from, struggling with learning or learning disorder, or they're really impulsive, disruptive in class, and there's concerns that maybe the teachers are raising, and now they've communicated that to the parent. Or you have a child that's really anxious, and it seems like it's beyond just the general check-in with your school counselor kind of level. When they are referred to you, what does that look like when they're going to make their way to you? And what should clients expect when it comes to even that testing itself? Like, what are the different types of psychological testing?
Sure. Yeah, that's a good question. So on the testing side, right, they would, if they're referred to us, and they can be referred to us by their pediatrician, by their school, by their therapist at another practice, all kinds of ways, right? Sometimes it's just word of mouth, like, oh, I had my kid evaluated, this place, maybe you should call them. So they come in, and typically we ask them questions about what's the presenting problem. So what's going on? And they give us just a quick elevator pitch of what their concerns are that they're looking for an evaluation for. And then we triage them, right, as a team, because we have a lot of different providers here. And so we always try to place them with whoever's going to be the best fit. So for example, we have 2 neuropsychologists on our staff as well, Dr. Stone and Dr. Tannenbaum. And then myself, I'm a psychologist, and I do psychological evaluations. Then we also have Dr. Blanchard, who does psychological evaluations. And so it really depends on what they're coming in for, that we try to place them with the appropriate evaluator. And I can talk a little bit about the differences between evaluations, but the next step is that they come in for a consultation. So it's a 1-hour appointment where they meet with the provider, and we ask them a lot of questions. They have to fill out a questionnaire ahead of time about what's going on, so that we don't make them repeat everything, right? And then we ask them a lot of questions about what, history, background, birth, development, what has their school life been like? If it's an adult, obviously it's all of their own personal history. Yeah. If it's a child, then we usually meet the parent first, and they tell us their child's history. And then at the end of the consultation, we give a recommendation about whether or not we think that an evaluation is warranted, and go over what that would entail. And so typically then, if we do decide to move forward with an evaluation, that may or may not include a school observation. So a lot of times, depending on the age of the child, we would try to go into the school and observe them for about an hour in their classroom environment without them knowing that we're there to watch them. So we can kind of get a feel for what their environment looks like there. How do they relate to some of their peers? Things like that. Then we meet with the child for an hour. That's called an intake appointment. Where we talk to the kid about how they feel about whatever is going on. How do they feel about school? How do they feel about their friends? And then we do 2 testing appointments. Typically, again, this can vary depending on the case and what's going on, but typically then it's 2 testing appointments. It's 3 hours each appointment. So 9 to 12 usually, because a lot of us are freshest in the morning, right? So we do not too early, but so we do 2 testing appointments on 2 different days, and they're usually from 9 to 12 here at the center. And so it ends up being 6 hours of testing, but the testing is one-on-one. I always tell all the kids who come in that, like, we're not going to put you in a room with a paper and pencil. This isn't that kind of test. You're going to sit with the psychologist, and we go over these items with you. It's an interactive experience. So it's not quite as painful as like sitting in a room taking a test. And then the final step is a feedback appointment, where we meet for an hour with the parents and the child and talk about what this all means. What were they really great at? What are their strengths? And what are some of the things that are more difficult for them? And then what does that mean moving forward? How are they going to address the things that are challenging to make it feel more manageable for them? So, and then of course they get a report.
Can I just say, it sounds like a test everybody should have. I mean, I'm going to do a test that's going to tell me my weaknesses and my strengths and how I'm supposed to improve. Sign me up.
I always say that I'm like really mad that I know all the tests, so I can't test myself, because I want to test myself.
Exactly. Like, it just sounds fabulous. Like, I mean,
some of them are like kind of fun too. Some of them are like puzzles and games.
Oh my gosh. Okay.
It tells us all kinds of different things about how your brain works, how we problem solve, how we adapt. It is, I totally like nerd out about it and think it's so fun, but
Yeah. And one of the things you told me, apparently, that I have to admit, I just thought, oh, neuropsych testing, psych testing, they're apparently different. Yes. So what does that look like? Just bird's eye view. Listen, this is a safe space, y'all. So
it's so confusing. Seriously, it really is. I mean, and you said to me, right? Like, we're all, our healthcare system, we're all so specialized, because there's just so much to know about how a person works, right? How we all think and live our lives, that it's confusing, and it's confusing for us who are in the field. So you can only imagine how other people feel, right? But so to answer your question, there are different types of evaluations that you can get. So a psychoeducational evaluation, for example, might be an evaluation that you get through your school district, where we just look at cognitive performance and educational achievement. So like, how do you do on reading, writing, and math? And what are your cognitive skills? Verbal, nonverbal problem solving, working memory, processing speed, things like that. So we're looking at those pieces of the puzzle and comparing those. That's a psychoeducational evaluation. We, of course, can do those too. But a lot of times people might access those first through their school district. Then a psychological evaluation looks at those pieces and then includes other components like executive functioning, be social and emotional functioning. It might look more into developmental history. So it can include a lot of other components there, maybe more extensive memory testing, things like that. And then a neuropsychological evaluation is all about how the brain and behavior are tied together. And so, I'm not a neuropsychologist, so this is my take, right? But it's about the relationship between your brain and your behavior. And so it is a next level of specialty. It's a highly specialized level of training where they might take referrals for like a reason why you might get referred for a neuropsychological evaluation, for example, is if you had a neurological condition like hydrocephalus or cerebral palsy or a tumor, brain tumor. If you've had a brain injury, if you've had a medical condition that affects your cognition, a very complicated birth history. It's all about how and why the brain is doing what it's doing and how that connects to a person's behavior. So those are some examples, it's not an extensive list of why you might need a neuropsychological evaluation as opposed to a psychological evaluation.
Got it. That is so helpful. That is so helpful. Thank you so much for shedding light. I'm telling you, I feel like some of these conversations, I learn more than my audience does. Like, I'm like, okay.
I love it. I mean, I love that you do this because I think it's such a valuable resource.
Yeah.
So we really do have to be a team.
Oh yeah, I know. And I think this is the power of collaboration. This is why it's not just one system, right? I talk all day till I'm blue in the face about sleep, but then there's so many other aspects that impacts the child that will in turn be affected by sleep or potentially impact their sleep. Which takes me to one question. You'd said this is almost literally a whole day's worth of testing. And I personally have had, from my experience and working with so many families, I've had them say, oh my goodness, this child's been like all over the place and all of that. And we take them for testing and they are deeply enmeshed in sleep issues. Like the child is tired. The child is irritable nonstop. And sometimes it's hard to untangle what is sleep and what is, ADHD or autism, like what plays what. But so maybe help us look from your end as someone who does this testings, who sees this patients and, and then provide therapy. Like, how does sleep weave in, even from the moment they walk through the door and are getting evaluated for these conditions? And potentially, how does that impact their treatment, the treatment modalities that you recommend?
It's a really good question and like so multi-level, right?
I know.
And like you said, it's so complicated.
Yeah.
I mean, one of the most important questions we ask is, how's your sleep? And also, how has your sleep been over time, right? How did your child sleep as an infant, as a toddler? How are they sleeping now? We ask, and then what specifically is hard about sleep? If they're having a sleep issue, is it that they have difficulty falling asleep, that they have midnight awakenings, that they have difficulty waking up in the morning? Are they having nightmares? Like, because different things might mean different things, right?
Absolutely.
Like, and so we always ask those questions, and then sometimes those things can be really helpful for kind of guiding us in a particular direction. For example, right, the quintessential example we all know, if someone seems like their brain won't shut down before sleep, like they're having trouble sleeping, that could mean that they have anxiety, right? It could mean that they have ADHD. It could mean neither of those things, right?
Yeah.
But so we do ask those questions. When someone comes in for testing, we always ask, the first question I ask is, did you eat breakfast? And how did you sleep last night? And sometimes people say, I didn't sleep great because I was nervous about this, or I didn't sleep great because I never sleep great. And those are things we write down and we include in our kind of profile and our understanding of what this child or this adult is struggling with.
Got it.
And it certainly informs our recommendations, right? Depending on what they say, there's often times where I have said, I strongly recommend that you need to get a sleep study done, or that you benefit from getting a sleep study done to make sure that there isn't something else impacting your sleep. Like, we don't want to say that this is all because of mental health. There might be other components and they might be playing into each other.
Yeah.
Right. We know that if someone isn't getting good sleep, their mental health is going to struggle. And we know that someone's mental health could struggle because they're not getting good sleep.
Yeah.
So, so that's a piece about the evaluation. And then on the treatment side, again, there have been many times where I'm seeing someone for therapy and I'm still also recommending that they go get a sleep study done to investigate, to really kind of flesh that out, and take a look at what's going on at, from your angle, because there are so many things that you do that I don't know about.
Yeah. I love this. I think this is so important, and this is so validating for the recommendations that I provide when I see patients with these issues. And that is what you said. You will, if they need it, and most of the time they do need psychotherapy, and you will refer for them to get the evaluation for their sleep issues, because it's not mutually, it's not either or, it is and.
Mm-hmm.
And I think this is so important because, and I say this again and again, sometimes we just assume, oh yeah, maybe once we get them into therapy and get them on the right medications for their anxiety and depression, the sleep issues will go away. Many times it doesn't.
Right.
And so when we're looking at this, all this important fundamentals, at the end of the day, it gives us a much better outcome than, if we just said, oh, you know what, let's all just work on your sleep and, don't worry, all the mental health which will go away. Of course not. And so I think that is powerful. And some of the things you raised, you talked about, whether it's the difficulties falling asleep or staying asleep or waking up early in the morning, that might be insomnia. And there's so many reasons a child or an adult might have insomnia. And sometimes it may be related to an underlying anxiety. It may be related to them having ADHD or autism or things like that. So it's funny. This is what I do. And just, quick, when I look at these issues, and this is exactly what I tell parents. And I talked about that extensively in my book, Beyond Tired, which is on Amazon. So grab a copy. Which is this: when we're looking at sleep issues, we're looking at it in three main categories. You're looking at it from what are medical issues that are driving sleep problems. So is there sleep apnea? Is there restless leg syndrome? Do they have reflux? Do they have uncontrolled asthma and they're up coughing all night? Do they have eczema and they're up itching all night? Like medical issues. And it may not necessarily be an organic sleep problem, but it might be. Many times it is. And we do know with ADHD, autism, and some of these other conditions, there's a higher risk of medical sleep issues. So that's the first category. So we're walking through it because families come and they're like, whoa, the sleep is horrible. And you're just like, okay. Let's get a framework in place. And then the second piece or the second bucket I usually will talk about are more of the behavioral factors, right? Is it that teen that won't, they can't get off the phone?
Right.
Is it caffeine? Is it the environment? Is it the toddler that's really playing, having FOMO at bedtime, and so there's bedtime resistance? Or is it that child who has anxiety, separation anxiety at bedtime and needs a parent to co-sleep with them, So we then look at that as well. And then the third, I call them sort of the 24-hour factors. Like your anxiety is not going to be like, okay, I'm going to sit right here by your bedside table. I'll see you in the morning. Good night, right?
That's what we wish.
I know, we would wish, right? That nervous system that's just so amped up just really just infiltrates into the night. It doesn't go away. So when we sort of piece it out like that, then we could say, okay, what are the things we need to do within the medical bucket? Do we need testing? Do we need blood work? Do we need nutritional evaluation? Do we need whatever, right? Do behavioral strategies? Do we need an insomnia? Like sometimes we'll do cognitive behavioral therapy for insomnia and things like that. Do we need all of those behavioral strategies, especially when you have younger kids? And then the final thing is, where are you from the mental health perspective? Do you have a therapist? Do you need to see a psychiatrist? Do you need to go and get some psychological testing? And so you can see, like many times, I have folks in all three buckets, but it helps us to be very streamlined so that people just don't feel like spaghetti on the wall kind of phenomenon is going on. So thank you so much for highlighting that, because I'm always saying, okay, you need to go get tested, or go get seen or start therapy. And it's always beautiful to see on the other end how much our work really, really aligns so well.
I couldn't agree more, and I appreciate everything you just shared, and how and your streamlined approach that, because I just think it just makes so much sense, right? And it's the same thing here, like what you were saying about, is it this, is it that? Like, if, especially from a therapeutic standpoint, also, if I teach sleep hygiene and cognitive strategies for like settling your brain before sleep and settling your body before sleep, and I talk to parents about making adjustments in the home to, like, we need to get rid of the phone at night, or we need to make some changes that are going to promote healthy sleep. Especially if we do those things and it still isn't working, then I'm like, all right, something's going on here, right? And so, and I like you said, also much higher rates of sleep disorders in kids with ADHD, in kids with autism spectrum disorder. And I think it's not talked about enough. It's not acknowledged enough. We're just like, oh, I know it's hard for you to sleep. Like, no, sleep is so important. It's so important.
Yeah, no, I agree. And I think also just helping people know that there are options, like not feel like, oh, well, this is what we're just going to live with. And I think that's empowering for families. And also just knowing that these are very important pieces to the puzzle. It's not going to be the thing that's suddenly going to take all the problems away, but it's definitely going to make that journey a lot easier, because a well-rested brain can process better, it's more emotionally stable, and actually can enjoy, the benefits of therapy and things like that for longer. So super, super helpful to know that this work you do is amazing.
And you. Thank you. Thank you for saying that.
Awesome. No, so this has been, I think this has been phenomenal. I've really enjoyed talking with you. So where can people find you? And also, do you have like any final words, final thoughts, and all that good stuff?
Oh, final words and final thoughts. I have to think about that. But where people can find me is easy. So like I said, I'm part of a private practice, a group practice called the Center for Neuropsychology and Counseling, and we are located in Chalfont, PA. And you can find information on our website, which is www.thecenterinpa.com. We have a phone number and an email. You can see all of our providers and all of our information on there. So we're easy to find. We also have social media. So you can find us on Instagram, Facebook, Psychology Today. So there's lots of ways. But yes, thecenterinpa.com is how you can find us. In terms of final thoughts, I think I just want to thank you so much, Dr. Brown, for having me, because I think, like I said, that this is so important, what you're doing, of just kind of, it really does take a team. Our healthcare system is broken into small parts, but we are not. And so I think considering the whole person, and both sleep and mental health are all about your brain, right? And so many people are very quick to go to the doctor once a year, which I support, but going to the doctor once a year for your annual physical to make sure everything is good with your physical body. But your brain is in charge of all of those things, right? Your brain is what gets you through every day and every night. And so I think making sure that your brain is doing well and is taking care of you is really important.
I love that. I love that thought, that what you just said. The healthcare system is broken, but we are not. It's broken. It's also broken into various pieces, but we are not.
Yeah. Yeah. Broken into parts, but we are not parts. We are whole.
No, we are whole. We are whole. We are whole. So that's beautiful. And thank you. Yes. Thank you so much for coming. Thank you for shedding so much light on the approach to psychological testing in kids and in adults. I think this is so helpful because folks don't know where to start. And I think having that evaluation, even knowing what diagnosis you're working with rather than assuming or presuming, is important. And we didn't even talk about like some of the benefits of those, like the kind of access you then have when you know, like, whether it's a plan for school, a learning plan for school, the recommendations that would then help you to thrive fully. And I think that means we're going to have you back.
would love to come back. I would love
Awesome.
to.
Awesome. Well, thank you all for being here. Thank you for listening. If you come back to watch it, let us know. Let's know your thoughts, your takeaways. And if you're out there, and we've talked a lot about sleep, we've talked a lot about mental health. If you're at the point where you are struggling, we have the information for Dr. Stacey's practice. Phenomenal, phenomenal. Remind me, you do see patients virtually too, right?
Yes, yes. And
Perfect.
I am one of a few providers in our center also that is, I have what's called my SciPac certification, which means that I can see patients via telehealth in 42 states.
There you have it. I could see patients by telehealth in 3 states. So she's like several up. Okay, but if you're in the PA, New Jersey, California, definitely give us a call, schedule an appointment. You could go to our website, www.therestfulsleepplace.com, or call us 215-607-8297. And there is a spot for you or your child with sleeping issues, and we look forward to supporting you. If you're not in those 3 states, you can grab a copy of my book. It's Beyond Tired, because Beyond Tired is a thing. So grab it from Amazon and it will change your life. It's a good place to start. Thank you again. And until next time, I hope you rest well.